what we're really paying attention to at the Steinberg Institute this year is a focus on outcomes and accountability. What I talked about this morning in our panel was that despite the resources in the behavioral health space more than doubling in the past decade, we haven't seen an increase in the penetration rates, so people actually getting the care that they need. And that's a problem, right? Like, we don't want to be throwing money into a system and not proving that it's working, right? And access to care, quite honestly, isn't enough. Just getting into the care isn't enough if that care hasn't been proven to make your life better. And so I think that's really what we're focusing on, because despite these, the acknowledgement that there's a little bit of an economic constriction at the moment, we feel like focusing on outcomes and accountability makes really good sense, because if we spend our money efficiently and focus on those meaningful outcomes, then we can really transform these systems of care that are so broken. We have a bill this year, AB 459, with Assemblymember Haney's office. It is focused on outcomes and accountability, like I just spoke about. The vision really is to create a community stakeholder engagement process, to look at available data sets and engage your community in coming up with a system improvement plan to improve those outcomes over time, and to have a statewide dashboard about the financing and those outcomes where counties can kind of compare themselves to one another, and we can spread best practices to improve those outcomes over time. And so that's really our primary focus this year. We made it out of appropriations last week, which is a big hurdle considering the economy at the moment. And so we're really looking forward to seeing what's next for that.